Excellent. Wonderful. So you will get a copy of this as a free gift from me to you, and it's only for those that have registered. So if we don't have your details, then you won't get this information. However, we are live on Facebook, but it's always nice to get some extra information as well. So I hope you're safe and well. Thank you for being here today. And my name is Christine Blackledge Crown, and I'm doing the presentation here. I do have some of my team members in the chat who may reach out to you if there's any questions, etc. So I will be just focusing on the presentation, because if I start going into the chat box and looking at messages, it can distract me, and I don't want to affect the recording that you'll all be getting, for example. So thank you so much for being here today. I am truly blessed to have you all here. So thank you. So let's begin. Let's begin. You're either thinking of going into starting a healthcare business, or you are up and running as a healthcare business provider and you want to learn about how to get contracts. How do you perhaps diversify? Maybe you've got some contracts and you need to look at increasing your contracts that you've currently got, because you've possibly got staff members that are waiting to work and they're thinking, hang on a minute, there's no work. I'm going to have to go to someone else. And you don't want that, because you're leaving money on the table. And I'm telling you all now that you are leaving money on the table, because you should be looking for contracts every single day as a healthcare business owner. I'm just going to grab my water as well. It's water with lemon. So refreshing. So as a business owner, you can get contracts with the NHS. You can also get contracts with private sector bodies. And my solutions and my marketing strategy is absolutely phenomenal. And we have got clients that can vouch for that. We are going to get a really good testimonial, which should be tomorrow, from one of our clients that's doing extremely well with our proven system. They've actually gained 6 contracts within 4 weeks, and that's working with us. And I just wanted you to know that. So there is plenty of contracts for all healthcare businesses. There's no saturation. If anything, you need to be able to get the staff to cover. Now, getting the staff to cover, there is a way that you can do that as well, to also increase your viability for your business as well. So I'm just going to really start going into this. I just want to say thank you so much for being here, and I welcome all of you. And thank you for spending the time for you to be here today. I really do appreciate that, because you've also taken time out of your busy schedules. And I'm so grateful to that. And you should be able to pick up and learn quite a bit here today. So I want you all to grab your pen and paper, or get a Word document open and take some notes. Really take this in. I want you to think about what type of healthcare business that you want to actually run for your organization. Like I said, you could be up and running. You could be a care provider who's looking to diversify into perhaps NHS market in terms of providing staff members to the NHS, whether it be healthcare workers, support workers, locum doctors, etc. Or you may be a recruitment care agency that's looking at providing staff members in the community, where you're providing the regulated activity personal care, and you're a managed service, for example. So you may be looking at different ways that you can diversify, because as a healthcare business owner, you really should be looking at multiple streams of income and not just one. You know, that's you're doing home care, that's you being a recruitment care agency, you're doing supported living, you're doing semi-independent unit, you're doing care home for the elderly, children's home. You're building multiple different streams of healthcare businesses. And that's the model that I teach. And that's the model that I used to do for myself. And I also help our clients to achieve as well. So just think about what I've just said. I hope you're taking notes. So although this is recorded and you will get the recording, you know, it's always good to write things down because you learn better when you write things down. So please take note. So after me spending over 20 years working with the support of a mentor, I had no one else to turn to. I knew that I needed help with setting up and running my own healthcare businesses. And that's why I've created the care business coaching and mentoring systems, so you would not have to undergo the same experience. I would like to see everyone living their highest vision, more time with your family, loved ones, and friends. I had a coach, and I'm referring to for my healthcare business. I'm not on about my development coaches that I have, who I'm truly blessed and thankful that they are in my life. And I currently use them today. For example, I'm referring to having someone come in to teach me how to run my healthcare business. And I did that. But you know what? I was actually teaching him about how to get contracts, how to run a healthcare business. So in the end, it wasn't actually benefiting me. Well, actually, it gave me a kick up the bum, should I say, to say, just get on with it. And that's what I did. I had to, because I had no one that could really show me how. And this was a big, large organization, which is still currently running today. I paid thousands of pounds for it, but they did me a favor because look, I'm here today. So I'm very grateful to that. Okay. So I just wanted to mention that. Now, I wanted to be a coach 30 years ago, but I felt I had to learn how to do healthcare businesses in order for me to feel genuine, in order to help people with their healthcare businesses. So for 20 years, I was setting up different businesses, healthcare businesses, creating multiple 7-figure businesses, for example. And then I thought, right, okay, 9 years ago, I thought, I'm now ready to be a coach, but I'm actually a mentor. I'm a transformational coach, because I'm not there to just you sit and watch me. I'm there for you to take action and really do the systems, learn from it, and implement and take action. That's when you create the success. But if you just sit and watch, then you're not going to really get very far. So this is my goal, is to help 10 people become millionaires a year, so that I can help change 1 billion lives within 125 years. That's my legacy. I want to help. Okay. So I can show you how to get contracts through NHS, care homes, and in the community, etc. Don't miss the opportunity of how to learn about getting contracts. So I want you to pay close attention to the training today, because that's what we're going to be covering. And you'll need a pen and paper, or have your laptop open with a Word document, for example, and that will help you to get used to doing this. Because as business owners, you should be doing this every single day, Monday to Friday. You should be focusing on where to get contracts, how your company can get contracts, and what contracts are available. Looking at spending a minimum of 2 hours a day on your business development, minimum that you should be doing. I'll just drink my water whilst you read this. Hopefully you can see my screen, my PowerPoint presentation. Right, so one good way is that you build a database of your potential clients, whether it is care homes, whether it's NHS, in terms of CCGs, clinical commissioning groups, whether it is, for example, NHS hospitals that you want to work with, and that could be private sector hospitals, it could be secure units, which are private, as well as the NHS mental health hospitals, for example. So you've got to look at building a database for the clients that you want to work with. And that's important for you to do because, as I said, as a business owner, you need to be looking for contracts on a daily basis. But also you've got to think about, if you haven't started, then what services are you going to do? Or maybe you're going to enhance and diversify and add another service to your healthcare business that you've already got running. And I hope that you are doing this. If you are a business owner that's already up and running, you should be looking at diversifying, getting more types of services added on to what you're currently doing, because you will just stay stagnant. You're not going to break that glass ceiling if you continue staying just in one type of agency, for example. Okay, so what type of services are you going to provide? Are you going to be a recruitment agency? Are you going to be a home care agency? What age group are you going to be serving? Will it be adults, for example, 18 to 24 to 25, for example? Or is it 18 to 65 plus, or 18 to 65? So write that down for those of you that are not up and running yet. You still need to be making these notes so you've got a clear vision of where you're going. And the same for you. If you are up and running, you may be doing home care. So what about doing recruitment, where you're sending nurses and support workers into hospitals? What about doing that as well? So then you need to look at, okay, if I was doing home care in the community, I now want to do recruitment, add recruitment to the company. Then I'm going to do nurses, support workers, and locums, for example, doctors. Okay, so what age group will you be serving? Maybe you was doing adults. Maybe you want to look at doing children's services. You know, you've got children's services, adults. There's also elderly as well. So you need to write this down and think about diversifying if you are a business up and running. If not, then the world is your oyster. So you choose what you're going to work on first, and this can be your 12-month plan. And the same for business owners up and running. You can do a 12-month plan of this so that you can diversify. So one of the places to look for contracts is the government website, which is called Contract Finder. And if my team can let people in, so I'm not seeing the notification. Thank you. So Contract Finder is one of them. So Contract Finder, you can create an account on here, for example, and you will get updates of what contracts are available and what is around. Now, there's various ways. Now, when I first started, I was looking at the lower value contracts, because a lot of people think they can just go into this and go straight into something which is like 10 million. No, you can't. You have to make sure that you're applying for contracts which is for small to medium-sized enterprises. Now, what you also need to be thinking about is getting contracts with organizations as well that are already up and running, that have got contracts, that are willing to subcontract with you. Because when you're looking at applying for the larger contracts, the organizations, the buyers, you're the supplier because you're supplying your staff members to the buyer, to the contract, to deliver the service, for example. You need to be able to show that you can provide 3 references, that you've got a proven track record of delivering a service. And this is the same for when you're applying for CQC. If you have not had any managerial experience, you've not managed a care service, for example, before, then this is one way for you to get used to doing it without CQC registration. You can run a nursing agency, a recruitment care agency, without CQC registration. because you're providing staff members into care homes as well as into NHS hospitals who are already regulated, registered with the Care Quality Commission. So therefore, you don't need to register with the Care Quality Commission if you're providing staff on that basis, because the organization is already regulated. So it doesn't make sense to send regulation upon regulation, although being registered with the Care Quality Commission is the best badge of honor that you could have as a care organization, but you don't need to do that to run a recruitment care agency. And there's many people that have been successful that's ran a care agency before without CQC registration, and they've hit, you know, 7 figures, you know, and you too can potentially hit 7 figures in your business, but you want to start off with 6 figures. So for example, your first year, you may want to do 580,000, for example, and then you will increase as each year goes on, because you're diversifying, you're adding more staff, you're increasing your turnover, but also you're increasing the services that you're providing as well. Okay, so think about the contracts. Like when I first started, I was looking at the lower value contracts, and then I was building up to the point of 5,000 hours a week, for example. And that's what you can do as well. So on Contract Finder, they do lower value contracts as well as higher value contracts. So try and look for value contracts which are under, say, 118,000, for example. And then when you want to go for the higher one, then go for ones for 118,000 or more, providing that you that it says suitable for SME. Then there's no reason why you can't apply for that contract as well. So just bear that in mind. I was doing multiple small contracts, and that built up to me having a large turnover, for example, and same for clients as well. So I'm just going to press the start button here on Start Now on Contract Finder, and you will see. Oh. So like I said in my previous slide, Contract Finder lets you search for contracts for information about contracts worth over £10,000 with the government and its agencies. You can use Contract Finder. And here we've got keywords, which I'll be putting in shortly, which is health support worker, recruitment agency, nursing agency, home care agency, supported living, enablement. So you're looking at keywords that the buyer, it could be the NHS, it could be a group of care homes, for example, it could be private sector, large organizations, groups of organizations that are using keywords in order to find you, but also you've got to put keywords in to find them. And then you're going to meet up and you'll see their contracts that they're looking to tender. And then you're going to submit your interest for that tender. And then you're going to submit the documents that are required, as well as answer the tender questions. And sometimes there'll be a list of, say, 6 questions. Sometimes it could be 30. It depends who the buyer is, what the criteria is, and how they're going to evaluate as well. Okay, so in terms of the questions, they look at questions which can add up to 100, and you have to at least meet what the criteria is. They may say that you must pass a score of, say, 51 or more in order to be successful in getting that contract. So I'm just going to click the link here, and like I said, I'm going to put the keywords in, and you will use different keywords according to your organization. I'll just make sure that you can see my screen. So I'm now on Contract Finder. I'm also going to put this link into the chat box. So if anyone wants to practice along with me. Hi, Speewee. Hi. Okay, so that is now in the chat box. Now, this is the contract finder web page here. That's what I showed you on the presentation slide as well. And I'm going to press start now. And this will take me to their page. And I'm going to put some keywords in. And you can put whatever service you're doing. If you're doing supported living, then you would put supported living. And you can put dynamic purchasing system, which will then enable you to meet with clinical commissioning groups, for example. And the dynamic purchasing system, I'll go through that shortly. And that is a way for you to be able to apply for contracts. You've got to apply to get onto their DPS, which is the dynamic purchasing system. And that is for you to provide a service to the buyer. And these contracts are available on a regular basis. So it's not like you have to wait 3-4 years, for example. You can apply anytime. And that's what the advantages of being a small to medium-sized enterprise, that you're able to apply for contracts at any time of the year. So I'm just going to put in here some keywords. So I'm going to do healthcare, supported living, depends what I'm doing. I'm going to put mental health support. You can put home care if you're doing home care. You can also put in enablement. What other words could you use? That's the thing you've got to think about. Write down all of the keywords that the service that you're providing, but also the buyer is looking for. So I'm going to put recruitment. I'll even put international recruitment. I'm going to put medical staffing. I'm going to put clinical. I'm going to put non-clinical. Clinical staff. Okay. I'm putting all locations because I want to see all of the locations, but you can put it according to region or postcode and then branch out from there. You can do regions next, and you can do all locations. But me personally, if I was just starting out, even if I was a business that was up and running and doing well, I would still put all locations because I want to look at what the options are out there and to see about me finding staff in those locations, because it's not you that's going to be going out covering the care. You don't want to be working in your business, you want to be working on your business. So it's not about you going out to cover the care. Okay, so I put all locations. You can even here put awarded contracts, and then you can see those that have been awarded contracts, and then look at working in partnership with them by subcontracting with them. And then you've then got your references for your organization so that you can provide that when you're looking at applying for the bigger contracts. You have to take things step by step when you're just starting out. Otherwise, you can't handle something which is too big for you. Okay, it's like if you go into a gym, you're not going to go straight and pick up the heaviest weight in the gym. You're going to pick up the smaller weight first till you get customized and get strong, and you build up your strength, your stamina, and then you go on to the next level, and then the next level, then the next level. And this is the important thing that you need to remember as a new starter, that you want to go into it in a steady way that's not going to overwhelm you. So I'm just going to press search. Hope that's making sense to everyone. And the results have come up here. Yeah, you can see, excellent, good. So the results have come up here. So there's lots of different types of contracts. You need to register in order to be able to express an interest, but you don't need to register to have a look at contract opportunities. So this is, let's have a look here. Health industry, locations, London, tells you the value of the contract here. Published, the approach to market date is the 15th. The contract start date will be the 1st of April, 2023. It also says here that it is suitable for SME, for small to medium-sized enterprises. So this is something which you can look at applying for. And I'm just reading through, you have to read through the descriptions to make sure that you meet the criteria. That's for messages. If so, questions have now been closed. Prior to the deadline for submission, 12 noon. So this one is, it's not open. So let's go, because there's the deadline. So you have to look to make sure you read through things and that it makes sense for your organization. However, yeah, so that one's done. Let's have a look at the next one. So this one's closing date is the 14th. So there's still time for this one, for example. So you have to just look through to see whether you're able to provide that service. So like for this is suitable for SME, but the closing date is the 22nd of August for this one. If you specialize in mental health or you're a healthcare professional, then there's no reason why. You just need to read through and see what it is that they're asking. And then you would then express an interest, but you need to be able to register in order to just press the registration button here in order to actually be able to express an interest. So I'm just showing you where they are. This one says non-clinical staffing. Let's see what the closing date is. Approach to market. Suitable for SMEs. And this is with the Crown Commercial Service. And this is for non-clinical, temporary and fixed term staff. So where it says that the invitation to tender will be issued via, and they've given you the website here. It's telling you what the budget is. So you have to follow the descriptions in the, follow the instructions in the description, which is saying invitation to tender, which is this, for example, and this is Crown Commercial. Now that one looked like quite a good one, so I just wanted you to know that as well. So that is a good example about where to find contracts, okay? And learning how to submit a tender in terms of how to find the, how to find the contract, and then you can express an interest. But you need to look and read through to make sure you meet the criteria as well, and that you're able to answer the tender questions, which will be related to what the buyer and the service is about, to ensure that you're able to provide a positive outcome. So I'm just going to go back to the slide, and then I'm going to share the screen for the presentation. So where do you find contracts? So Contract Finder is one of them, which also led on to another site as well. Another site is LPP, which is the London Procurement Partnership. Okay, this is where you will find a large selection of contracts as well. Just click this link here. This is, let me just go on here. So the type of contracts that you're looking for is workforce. Well, that's if you're doing workforce. There's lots of different types of contracts. There's clinical digital solutions, which, you know, there is a massive need now for this as well, which that's another program, which you've got the web class next week, which is a free web class, which talks about healthcare technology, okay? And we do this, and we also do global training as well. There's also estate facilities and professional services, medicines, optimization, pharmaceutical, for example, but workforce, this is what this is about today. And that is about you providing staff, whether it is temporary workforce or permanent workforce, then, you know, you get to decide, for example. And I'm just going to the supplier section here. Just to tell you about London Procurement Partnership. NHS London Procurement Partnership is one of the national procurement hubs servicing the health community in London and beyond. And it says the members extend across acute, community and mental health sectors, as well as primary care and clinical commissioning. And it says about the purpose, that they are there to make sure that this affords our members a benefit of equal status in input into our vision, structure, products and services through a series of membership forums and the governance of member-led steering bodies, for example. It just talks about value. And then it also then says, become a member. But what you want to do is you want to become a supplier. Okay. Right, I'll just share my slide. Thank you. Just goes to show people are listening. Thank you for that. Right. So this is the page here, which is the LPP. I'll just put this in the chat box. So you want to look at the supplier area. It also talks about DPS, dynamic purchasing system, but here it says for suppliers. You are a supplier because you're supplying the services, and the buyer buys the services from you. So it says at NHS LPP, we pride ourselves on working with the very best suppliers for the benefit of the NHS and its patients. We highly value the suppliers we work with because we know they share our high standards and we support their innovation through knowledge and contribution to the NHS as a whole. And this just talks about the supplier. It's got more information here. I'll just put this link in the chat box so that you're able to see for yourself as well. So it's got here dynamic purchasing system, or you need to know. And this gives you information about the DPS. And who is it for? It's for you. It's for small to medium-sized enterprises. It says a dynamic purchasing system is unlike a traditional framework for the supply of goods, works, or services. A DPS is an electronic system which suppliers can join at any time. It's an open market solution. A DPS is designed to give buyers access to a pool of pre-qualified suppliers. DPS managed by NHS LPP are available for use by entire public sector. A DPS can be divided into categories of work, services, or goods known as lots. Suppliers can apply to be listed listed on a single or multiple lots within a DPS. So get familiar with this. I'm just going to put this into the chat box as well. So it just goes through about suppliers. You can also register if you want to apply to be a supplier. This is the link here telling you that you can register to be a supplier. And I just want to make sure that you can see the page I'm on. Yes, you can. Excellent. So you want to become a supplier because these are the members here, which is the hospitals, NHS trusts, for example, teaching hospitals, groups of care homes, the larger organizations that are looking for suppliers like you to provide them with your services. So you can go here to this page where it says supplier registration. And then you can then register. And I'll just put this here. Just bear with me 1 second. Okay, so this is the page where you would register. And on here, these are the contract opportunities. There's hundreds and hundreds of contract opportunities. You can look at providing them with a service, for example. So I'm just looking here. I'm just reading this. So when you find something that you're interested in, you've always got to look to see whether it's something that resonates with you and whether you're able to meet the needs of that contract by having the qualified, compliant, competent staff members. So here with this particular contract, it also tells you you need to look at all of the attachments to make sure that you meet the needs of that contract. So you would download everything and make sure that you are ticked off just to make sure that you've got all of that information ready to submit your contract. If there's a contract that you're interested in, then you would click register your interest. But first you have to, in order to submit your interests, express an interest, you need to register with the contract itself. So this section here where it says expression of interest window, look at what the date is, and then you're then able to apply for it. If it's within date, then you would need to register your interest. So I'll just go back to the slide and I'll just share that with everyone. Okay, so the London Procurement Partnership is one of them. And that's what I've just showed you just now. And there's also another way that you can do this is by having the database, which is the Care Quality Commission database. And this is where you build your database of care homes or whatever organization it is that you're looking to work with as well. So you would look at approaching them to get work for your candidates that you've got on your books. So they're calling you, they want work. So you then have to be looking for work for them. And this is one way where you can build a database of care homes that you're going to start making a call to. And I'm just going to make sure that you can see my screen with the Care Quality Commission. And this is whereby you're looking at care homes. You've got candidates waiting, they're looking for a job. So you've then got to look at finding work for them. So then we're going to go here to care homes. And I'm just going to put this in the chat box as well. I hope everyone's enjoying this. You could just type yes in the chat box. That's really good. That helps me. So I've just put in the chat box the link for CQC database, for example. Thank you. Thank you. Excellent. So care homes. Now, this is how you build a database. People charge thousands of pounds for these types of databases, but you can actually do this yourself. Okay. So I've done care homes. Now looking at my location. So where am I located? I'm going to put London, for example. Where it says here, mile radius, I'm going to do 25-mile radius, and then I'm going to do search. Let's drink my water. So as you can see here, thank you. So as you can see here, I've got 2,073 results. Now, this is of care homes. To the left of the side, it says whether it's outstanding, whether it's good, whether it requires improvement, whether it's inadequate. I would look at approaching the ones where it says requires improvement and inadequate. I wouldn't approach the ones where it says not rated, because they may not have many clients in there, for example. You can save them for last. I'm not saying to, rule them out, but I would go for the first two that I mentioned, because it could be a sign that they need staff, and that would be where you would come in to supply temporary staff members or permanent staff members. Now, always look at, when you are approaching organizations, that you are looking for a long-term relationship with them. Okay, there's a temporary, you're providing them with temporary staff members, but also look at doing a long-term solution with them. So then you've got a really good contract where you're providing both temp as well as perm, for example. Okay, and you're there to help them meet the needs of the home and the service users that use the service, for example, the adults, for example. Okay, I would then look at good and outstanding afterwards, but I would target those two first. So for demonstration purposes, I'm just going to show you all, because I've got all care homes, which is the 2,073. Now, there's all different types of services here on the Care Quality Commission's website. There's community services, which you can look at doing instead, mental health services, service providers, etc. There's services in the home, domiciliary, there's clinics, there's dentists, GP services, etc. But for demonstration purposes, I'm doing care homes. So like I said, I've got 2,073 results here. And sometimes you may hear me repeat something more than once, because I want you to remember what I've said, because it's important. And sometimes when you're approaching care homes, it takes up to 5, 6, 7 times for them to say yes to you. So don't give up on the first hurdle. As I always say, KFC, Colonel Sanders, it took him 1,009 no's before he got his first yes. If he gave up on the first hurdle, KFC wouldn't be around today. And we all know KFC. So it's left his legacy, for example. Okay, so I just wanted to point that out to you. Okay, so when you're ringing a care home, you're going to have to do it more than once. And I always say to go out and visit them as well, because your results are far more stronger than just picking up the phone. And also it breaks up your day. Go and do 1 day of visiting or 2 days visiting a week. So then that way you're building up a relationship. They get used to seeing you. They know who you are, rather than this voice on the phone. And we cover this in our NHS bidding contract. And one of our clients was able to get multiple contracts on that basis by following what I did teach in one of my systems. And it does work. They want to see your face, but you've got to go in a professional way. There's a certain way you've got to do things. You can't just show up with a business card and hope that that's going to get you through. No, it has to be more than that. You've got to present your company in a way that's going to make you stand out and make you so professional. And you will feel confident as well, because you will have everything in a professional manner as well. Okay, so I just wanted to mention that. So I've got my searches here of 2,073, and I hope you've done the same thing by now. I was trying to give you time by talking as well. I'm going to scroll down to the bottom. of this page, and it says download the results as a spreadsheet. So you download the results as a spreadsheet, and then it then comes onto your computer, and it will come as an Excel sheet. I'm going to open the file, and I'll just make sure that you can see. Yes, you can see what I'm showing you here. And this spreadsheet, I'm just going to make it a bit bigger so that everyone can see properly. And the results I've downloaded, it's come as an Excel sheet, and I've got all these results here. Now, when you're making calls to care homes, you're really looking at doing a minimum of, say, 150, 200 calls a day. Yes, I know that seems a lot, but really it isn't, because sometimes people don't pick up the phone. So a call could just take you like half a second, for example. So there'll be a few calls where you're actually making meaningful conversations, i.e. the person's picked up, you've got through to someone, then you start to talk about your services. Yes, there's going to be a gatekeeper, and you have to learn how to get through the gatekeeper, but don't give up, because they need your services. You're there to help. You're not a salesperson. You're there to help them meet the needs of the service. Don't think of yourself as a salesperson, okay? So I've got this spreadsheet here, and I'm going to just open up the cells so that I can see the addresses, and I hope you're all following along with me. You can see the phone numbers are there. If any of the phone numbers are missing, you just have to go onto the website and get the phone number, for example, okay? Now, what I want you to do here is look at putting them into zones, and that's into day zones, like Monday to Friday zones. And this is where it's going to be different colors so that you know, like, for example, you know, when you go into an estate agent's, right, you see a massive map, don't you, on their wall of the location where they actually cover. Then you really should be doing the same thing. Even as a business owner or as a new business owner, you should have a map on your wall of your location, a big map where everyone can see, or where you've got it in your office, for example, and then get color coded pins to go on those maps of the areas that you're covering Monday to Friday calls zones, for example. Okay, and this is what this spreadsheet is all about. Okay, so I've got my list here. I'm going to go to the tab here on my Excel sheet, and there's a plus button. Now you can do this as I'm talking to you as well. Okay, this is what this web class is about. It's interactive. I want you to take action and practice what I'm showing you here. So you press the plus tab. It's a blank sheet. It says sheet 1. So I'm going to call this, I'm going to rename it, and I'm going to call it Monday Zone. And it's going to be Blue Zone, for example. Then I'm going to go to my data sheet, and I'm going to highlight all of it, and I'm going to color code this, or oops, something was in the way there. Just open this up again. So I'm going to color code this. So I would go down to say 150, 200, but I'm doing this for demonstration purposes. I'm going to color code this blue. And then I'm going to just make sure you can all see what I'm looking at. Yes, you can. Good. I'm then going to cut. And I'm going to paste this into the tab, the new tab that I've called and renamed Blue Zone. So that's the calls that I'll be making on Monday, for example, to all the care homes. I'll even create a section where for comments so that I can keep abreast with things as well. Then I'm going to go to the next section, and I'm then going to color code this as well. Just going to go all the way down, say to 150. I hope everyone's watching and learning, because then you should be able to do it for yourself. And I'm now going to create this, make it yellow zone. And this is going to be Tuesday. So I'm going to cut. I'm going to create the plus sign. I'm going to rename this, and I'm going to call it Tuesday. And it's going to be the yellow zone. So I've created that tab, and then I'm going to paste Tuesday, and I've got the yellow zone here. Then I'm going to go back to the database that I've got from the care homes, and I'll go to the next section, and then I'll rinse and repeat. Just keep doing the same until it's all gone. Depends how much time you've got on your hands, but you can do, in all honesty, you can do 200 calls within 2 hours. Seriously, that's how you will get once you get faster. But there's no reason why you can't do 200 hours within a couple of hours, because I've done it, and even my granddaughter can do it as well. So I'm just going to highlight this, and this will be, I'm going to go for red, and then I'm going to cut, and then I'm going to create another tab. And this is going to be my Wednesday. And I'll just paste it in here. So I've got my red. So I'm doing Monday to Friday. So you would do all of that till it's all gone. So you look at dividing this Monday to Friday. Sometimes you may, it depends where you are. Sometimes you may not get, 2073 results, for example. Okay. So that's how you build a database. I'm just going to go back to my slide. So you built your database, you need to call the care home, for example. And then you also need to keep calling. You've got to do multiple different things in order to create the traction so that you get contracts. You can't just be fixed in one area and expect to get work coming to you. And you can't expect just because you got your business set up or just because you registered with CQC that the work's going to just drop in your lap. That's not going to happen. You have to make that work. And I know some of you are working 9 to 5 and you're looking at approaching organizations during working hours, because that is when the care manager is there, for example, in care homes I'm referring to. So the best times to call care homes, you're not going to call during breakfast time. That is the worst time to ring because they're so busy. They're doing breakfast, medication. They will not entertain you. So you need to use the quiet times, i.e., for example, 11 to, it depends what time they have lunch, but 11 till 1 o'clock, for example. And then again, 2 till 4, for example. Okay. When you're doing visits, you go and visit them. You could look at visiting at 10:30 because that's when things start to get a bit quiet. I know it's not always quiet in a care home, but things are starting to quiet down because the breakfast has been served, washed and dressed, medication. Everyone's in a more relaxed state. Okay. So look at when you're approaching care homes. And when you approach the care homes, you need to make sure that you are dressed appropriately. No blingy gear, no jeans. Go in a smart, smart trousers, smart shirt, female, smart dress, or a nice skirt with a blouse, so that you're looking professional. I used to wear a suit, literally. I used to wear a suit. I used to wear a black suit with a white shirt and some black nice shoes, for example. I'd have a briefcase, or I'd have my file document case with my presentation folder, with my presentation information in the presentation folder. And it's how you dress. It's how you dress. It's how you look to grab people's attention. You want them to be able to want to use you and want to see that you are, you know, a professional service, for example. So just think about that when you're visiting the care homes, and you're going to face gatekeepers. It's natural. But, you know, if you are working, then maybe look at emailing the organization instead, if you're not able to have time off where you can go and visit, for example, or even make calls, or even try and make the calls during your lunch break. I'm not saying to take time away from your employer, because, you know, they're employing you and you need to make sure you've got your finances coming in, for example. Okay. Right, so that's how you build a database. Another way that you can look at organizations that are registered with the, you know, where they've got the sponsorship, for example, because they're looking for staff members. So you can look at providing staff members permanently to these organizations, but also there's a view of meeting their short-term needs as well. So there's a list here of healthcare organizations that have got sponsorship that are looking to recruit staff members. You could also look at approaching them to provide them with organizations, organizations, candidates. So give them a call, let them know you've got candidates available, and with a view to placing them permanently, but also look at if they've got any short-term needs. Let's go back to my slide. Make sure everyone can see. You need to make sure that when you are emailing organizations that you do a proper introductory of your services. You know, you don't just send your presentation pack. You've got to think about what wording that you're going to say, and it could be in the form that I'm writing to introduce our services, for example, the company name and where you're located and what services do you do. And then you would attach a presentation pack, for example. And that you will say that, you know, if that's okay with you, I'll be following up with a call, a phone call, for example. Or maybe you could say, if you know of anyone that would benefit from our services, please do pass on our details, for example. Okay. So looking at how you present yourself to potential clients is key. Okay. There's an email introduction, but there's also your presentation pack as well. And also, what is your telephone script going to be? So what documentation do you need? Some of the documentation is here. You need to have terms of business in place. You'll need an operations manual. You'll need a mission and a vision statement. You'll need a business plan, for example, because you need to know how much money you're going to earn in your business in order for it to be viable as well. You'll also need insurance. And this is one organization that does insurance. It's called jmginsurance.co.uk. You'll need to ensure that you've got the relevant cover, which is 5 million, for example. Sometimes the contract may say 2 million, but I've always gone with 5 million because you never know what contract you're going to be applying for. And my insurance was also that I applied for was 10 million because I wanted to be a premium supplier as well. Okay, so you need to think about employer's liability, professional indemnity, and public liability. Although you may have nurses that have got professional indemnity, you still need to have that even though you are an organization, because you are supplying staff under your organization's, stature, structure, not the self-employed contractor. For example, you have got the contract with the supplier, with the buyer, so you must have the relevant insurance in place. And they'll also tell you what insurance that you need to have. So staff compliance, you need to make sure that your staff are compliant. You won't get any work otherwise. And the key is to match, the key is to do what they want you to do and have staff that are compliant, for example. And they need to be high caliber staff members as well, because that's how you get the work. So compliance systems ensures that the medical and care staff can only be selected for work once they have completed a detailed registration process. All relevant employment training, DBS checks and references are confirmed by the agency, and the staff work record is checked again for each assignment. Without this validation, the candidate is unable to work. So you've got to look at the employment history and references. They have to be up to date, the CVs. Any gaps need to be explained. References, details from 2 most recent employers, for example, recent placements, verification of identity and right to work. Copy of passport, including a copy of front and back cover, proof of current address, 2 passport size photographs, proof of national insurance number, for example, DBS checks. What DBS checks have they had? Is it enhanced? Also, is it current? Is it within date? And is it an original copy that you've seen, for example? Mandatory training, what mandatory training have they had? And it needs to be up to date as well. When you apply for contracts, they will have a section about compliance and things like that, but also think about what is your methodology for your organization. What staff members are you providing? What type of staff members are you providing? What number of hours are you able to supply per month, for example, for each staff member? So, like I said, there's the sponsorships, organizations, and there's also, you need to also think about, if you are looking at recruiting staff from abroad, placing them with organizations, then you need to make sure that you're aware of the compliance. Because a lot of international candidates from abroad have been taken advantage of. So you don't want to really be you want to make sure that they're being safeguarded as well. So read up about the sponsor a skilled worker, whether you're doing this or whether you're not, for example. You still need to be aware of this. So do you want to learn more? If you want to learn more, we have various boot camps. We've got more web classes. We've got one next week, which is healthcare technology, which is huge. We are doing a program as well. And, you know, there's different types of healthcare businesses as well for you as a business owner, or maybe you're starting out. So you need to decide which ones you're going to do and create that as your 12-month plan as well. So we have the 6-figure accelerator mentorship program. And this is where we do the bid training online. It's a 90-day program, and we do government contracts, we do private sector contracts, etc. We've got clients currently on the program, and they are getting massive value from this because they're actually getting contracts. Okay, every single week we apply for contracts. Every single week we are submitting a contract as well as you learning as well. And like I said, one of the providers, you know, they've been able to get multiple contracts with only being with us for a few weeks. And I would like the same for you. For example, the 90-day bidding is for private as well as care homes, as well as NHS, for example. There's so much work out there as well. And I'd like you to be a part of that. It's 12 modules. The curriculum is 3 hours a week. It's not for everyone. This is for you if your business is set up and you've got no contracts, or maybe you've got contracts and you want to get to the next level. We've got clients who have got, for example, 75 hours a week up to 1,000 hours a week, you know, but they want to increase their business. So we don't accept any more than 20 people. And we do have some spaces left right now. And like I said, every single month you apply for at least one contract you submit. Within that 4 weeks, you're answering the tender questions. I'm helping you to answer those tender questions. My philosophy is that I want to teach you to be able to fish for a lifetime, not showing you how to just eat for one day. You know, my philosophy is fish for a lifetime. Teach a man to fish, for example, or woman to fish. It's both. Okay? So book your free 30-minute, 15 to 30-minute consultation with me so that I can talk to you to see whether it's a good fit for you and whether we're a good fit for you as well, because it has to work both ways. So there is an application process. We need to make sure that you have set up, your business isn't new, because if it is new, then you need to do the boot camp that we have. We have a boot camp which we're doing this weekend, which is fully sold out, so we don't have availability. But the next one is in September, which is only a few weeks away. So it is September the 2nd to the 3rd, for example, which is the next boot camp. So I'll just put the link there just so that you've all got it as well. So I want you to book your free 15-minute consultation with myself or the team, and we will gladly speak to you more in detail. But like I said, if you are a new startup and you haven't set your business up, then you need to do the boot camp. The boot camp still covers contracts, but this is for purely business owners that want contracts, that are ready to apply for contracts physically, with me being there to support you every week to answer those tender questions. Like, for example, they've been submitting contracts Okay, so Charlotte, if you book a free 15-minute consultation, that would be great. So that the next date is October, but if you book a free 15-minute consultation, we can also mention. So like I said, we've the dates is, we've got 2 more for this year for boot camp. So you need to really get it in now, like how we sold out in August, the boot camp coming up this weekend. There's only 2 more dates available this year, and that's September and October. So the September date I gave you, which was the 2nd to the 4th. Then the October date is, I'm not quite sure, so maybe one of the team members can put in the chat box what the dates are. If you want to go straight through onto the boot camp, we can send you the link for you to make your payment. Excellent. So yes, thank you for that. So the October dates are the 7th to the 9th of October for the boot camp. Like I said, it's the last 2 of the year. So really you need to get in now before it gets booked up. Like our August one got booked up. I'd hate for you to miss out. We do work on a first come, first serve basis, just to let you know. And we only allow 20 into each group, for example. So do book your free 15-minute consultation. Maybe one of the team members can put a link in for the boot camp as well. But we also have the system whereby it's not the live boot camp, but you still get the boot camp videos, you still get the training, etc. Apart from I'm not there live training you through the 3 days. So like I said, for the NHS bidding, it is £3,999. And you can also book your 30-minute strategy session, 15-minute strategy session to see whether you qualify, whether you're ready to go to the next level. If not, join the boot camp, because on the 3rd day, we still do contracts as well. I just wanted to show you some testimonials from some of our clients as well. I'd like you to join our Facebook group. The team members are going to put into the chat box the Facebook group page, and I'll show you that in a moment. This is the Facebook group page. I want you to join us. We have, it's very, very interactive, and we post every single day on there. You keep up to date with things. We give away free gifts as well. So it's very beneficial. It's for healthcare providers as well. So do request to join, but you do need to provide us with information. You can't just join without providing us information, because we don't know whether you really are a care provider. You could be there to try and spam. So this is the reason why we ask for your details. Are you a care provider? Even if you're not a care provider and you want to be, just say, I would like to be. And provide us with your email address so that we know that we're dealing with a real person and not some bot or some, spamming person, for example. Okay, so do join our Facebook group. No, you don't need to be CQC registered to apply for contracts. There's contracts there. Good question. There's contracts there which is for CQC registered. There's contracts for CQC rated. And there's contracts there for recruitment, care, nursing agencies. So and care homes, there's plenty, like I said, there's abundance for everyone. So you don't have to be CQC registered. So that was a very good question. Thank you for that. So do join our Facebook group. We only started this a couple of months ago, and we're looking to get it to 1,500 by October. That is the target, for example. Like I said, we have lots of information in the group. We give away freebies as well. It's very informative. Like now, I think this is going on now. Yes. I'm just seeing myself. There you go. So yeah, it's a really good group page to join. It's very interactive and you will learn so much. Do subscribe to our YouTube channel here as well. I'm just going to show you this. Subscribe to our YouTube channel. It is very informative. Our videos go out weekly and we do give lots of information on there. There's information about even how to approach organizations. How do you pitch to organizations as well? So it's very informative. You will learn a lot and it's about keeping abreast of things. And that's what this channel is about on YouTube as well. So subscribe, like our videos, watch them all because you will learn so much from it as well. And this is our website, which is startinganursingagency.co.uk, for example. On the YouTube channel, I've started introducing healthy food cooking as well, because as business owner, you still need to eat right. You still need to exercise. You still need to keep things going because you need to have that stamina to run a business. A healthcare business is not easy. You know, there's a lot of responsibility on your behalf. However, it is very rewarding, as well as you're passionate about serving, doing healthcare, then, you know, you just provide your services and you've got staff members to cover the work as well. This is our phone number here, which is 01903 898 135. Like I said, the NHS bidding program, it's brand new. It's been running since June the 29th, for example. And once you do get it, you do get the login details to start immediately. You can get started immediately with the view to applying for contracts and getting those contracts. Don't stay, if your business is up and running already, don't stay stagnant doing what you're doing. You know, look at what else you can do. Otherwise, you're going to miss out on so much more, and you could be so much bigger where you're leaving a legacy, an empire for yourself. Thank you. Thank you, Rachel. Okay, I will just show the contact screen again. I saw someone mention. There you go. So like I said, the phone number is 01903 898 135. And these are our contact links as well. The links are in the chat box as well. Yeah, that's fine. I'm glad you're finding this insightful. Thank you. You're welcome. Yeah, so please do book your free 15-minute consultation. Excellent. I'm glad you can book. You're welcome. You're welcome. So along with being a business owner, you've also got, especially with what we've, with the COVID situation, the pandemic that we've just been through, you've got to also look at protecting your mind as well. It's not just our service users, our minds, our wellness and well-being matters. We have to be the ones to value that and have business quality of life, because otherwise you'll just, the one running around doing everything, but you've also got to look after yourself. So I've created this new program, which is called Heal Your Money Blocks and Tap into Your Wealth Within. It's about your money blocks that you've got. We're so busy being busy that we're not actually getting our business up and running the way we should be. We need to have clarity for what we're doing in order for it to be successful. And this is one of the reasons why I've created this program. And I know what it's like to struggle and that you feel like nothing is going right in your life. And after I spent 30 years of my life studying techniques, I've spent over 150,000. I mean, it's probably more close to 200,000 on developing my mindset. That's coaching, manifestations, energy healing, in order to get rid of negative beliefs first. Also pray every day as well. So I brought many programs and I've studied them in order to learn the secrets of law of attraction. And I became an ambassador in the Covenant program, for example. And that was many years ago. And this is the link here for Heal Your Money Blocks. And I just want to show you this so that you can see, because I'm a business mentor, but also I'm a human being, and I want you to benefit from learning some techniques that's going to help you, because as I said, healthcare businesses are not easy. It's not easy. You're going to face some challenges. It's natural. Yeah, that's fine, dear. Thank you. Thank you for being here. It's natural. You're going to face some difficulties, but you need to be able to cope with these difficulties so that it doesn't stop you. It doesn't block you. Okay. Now, when I mention difficulties, it could be family, sickness, it could be bereavement, for example. It could be difficulties going on in your life, for example, but you still got to be able to learn how to cope and how to manage when these difficulties approaches in our life. And I've learned that. And, I've been through some difficulties in my life, but I've been able to be present and mindful. But at the same time, I know what my goal is. I know what the reason why I'm doing what I'm doing today. And that keeps me pushing forward. And you need that in your business to be able to cope with things, because you're going to face trials and tribulations. You're going to face difficulties. You're going to be looking at things and it's not going to make sense. And you're going to try and diversify and then get off course. It's good to keep grounded. It's also good to be able to have your mindset, your wealth mindset in a strong position. So this is why I've created one of these programs here, which helps you to deal and cope with your mindset when you're struggling, as well as strengthening your mindset as well. So let me just show you this. Sometimes you face a block, and that's because you need to do as much as possible, look at multiple different ways and not think that you are not able to get a contract. You've just got to look at what you've been doing and look at how else you can get a contract, even just to get started. How else can you get started? Okay, so I'm just going to continue with the slide. So like I said, Heal Your Money Blocks was created. So I realized as a business coach specializing in healthcare business, there was a missing ingredient in my programs, and this teaching business owners on money mindset to produce wealth in your business. I noticed some were getting this done with their business growth. I also noticed that the ones that achieved 7 figures did well and had the same mindset. However, when they started working with me, they originally did have money blocks. I started to see a pattern, and now I know that this can be reversed with simple techniques that I teach in my program here, for example. And that's daily techniques, it says. So if you want an empire, you're going to have to show up, stand up, speak up like never before, because you have to do this program of looking for contracts every single day in your business. You can't just do it once a week. You've got to do it every single day. And look at all the different types of contracts that you can look at applying for as an organization. So I teach you in the Money Blocks program is there's 7 modules of learning, and it's over 7 days. And a video will be sent to you daily. For example, you'll be able to log into portal to access the training, and you'll be able to listen and watch as well and learn and practice. So just going to go through some modules. Module 1 is move your environment. 12 techniques, for example, clearing techniques, because we need that. We need to clear our mind so that we can accept new things into there as well for our business. Module 2, emotions, energetics of manifestation. Module 3, business quality of life. You've got to have business quality of life. It's got to be a balance. You need to work on your business and not in your business. Module 4, mind, money, and manifestation. Module 5, be proud of who you are. Module 6, 7-figure wealth expansion, money mindset. And I've put the link, I believe, in the chat box for you to see for yourself, so you can look at this as well. So if you would like to learn how to bid and win contracts and more, clients for your healthcare business, over the past decades, I've helped hundreds of healthcare business owners like you get more and better contracts. We do it according to where you are currently at the moment. So it depends what level you are at, and looking at how you can get contracts with various organizations, whether it's the government or whether it is with NHS, for example, or private sector. Irene, she's got contracts. She was struggling to get contracts, and we were able to help her with our systems. She was a business support client as well. So with my secret bidding strategy, I'll help you to win up to 85% of contracts that you apply for, whether it's with private or governmental organizations. I'll show you how to create clients consistently without the usual hassles by applying for contracts for those organizations wanting your services. How to add up to 50K a month in revenue to your business in as little as 90 days. Now, I'm going to be showing you tomorrow a testimonial from a client who is on our NHS bidding contract. And they've got multiple contracts just with being with us for 4 weeks and by implementing what was showed to them as well. So in my experience, people think that bidding for contracts is harder than it actually is. And you possibly think it takes up too much time. But when you join the bidding program, it's 3 hours a week. Is that too much time to increase your business, to get it to where it needs to be? 3 hours a week. And the times that we do it is between 7 and 10 a.m. in the morning. That's when your brain is fresher, you're able to take things in. I'm not doing it at night time because you would have gone through work and been busy, your brain would be distracted. So that's why the morning is the best time to do it, to learn. The next one I want to do at 6 o'clock in the morning, just so you know. But I'm doing it at 7 o'clock. Okay, so what I want you to do is to think about where you want to be in the next 12 weeks. Okay, in just 3 hours a week for 12 weeks, you'll be able to 10x your company. You know, I'm there to show you the techniques. I'm there to help you answer the tender questions as well, so that you win the tenders. So how do you start applying? You'll be applying for 3 contracts minimum during the training. Really, you should be doing more, but 3 at a minimum. It is, like I said, it started July, even though it was created to start the 29th of June, but it started the 5th of July. And you'll learn directly from me. I'll be doing this live training online. You'll discover how to submit and win lucrative contracts. You'll apply for at least 3 contracts for your organization. I'll show you where to get contracts straight away so that you can get references, so that you can actually apply for the bigger contracts. That's key as well. If you've not got any contracts, no history, if they're asking for that history, then I'll show you a method of how you can get contracts to get experience and references as well. So the 90-day immersion blueprint contract accelerator program is worth at least £10,000. But today I'm offering it at £3,999. Don't buy today. I'm just letting you know what it is that I'm offering. And you can pay monthly, equal installments of £1,500 a month. So your chances are good, and you'll make your money back tenfold on your investment, and your training will be quicker. You'll learn so much in 12 weeks that would take you possibly 12 months. As an organization, you should be applying for contracts every single month. So that's 12 contracts a year that you should be doing. And if you're not, then you are doing your company a disservice. And I'm telling you that for those that are business owners. You need to start practicing to do this. And by joining the program, you will learn to do that as well as the boot camp. If you go through the boot camp, we create a 12-month program as well in there. So how do you get a spot? All you've got to do is say I'm in, or book a free 15-minute consultation, and I'll discuss it more with you as well. So book your free 15-minute strategy session to see whether you are a good fit. If you are, your business hasn't set up, then join the bootcamp. The bootcamp, we go through day 1, 2, and 3. We are applying for contracts. So there's something there for everyone. The boot camp is £597, and that will be live with me. And that is on the 2nd to the 4th of September. And then there's the October dates that's in the chat box as well for the boot camp at 597, for example. So do book your 15-minute appointment with us. Yeah, the 90-day, this is the thing. The clients that are doing I don't know if there's any clients here that's on the 90-day program here, but like I said, tomorrow the testimonial is coming through from an organization that has been blown away with the results that they have got. I'm there every single week and I'm saying, right, okay, I'm showing you this is a contract, apply for it now. Let's look at the answers. Here's the answers. And then you submit in your tender. You can't lose. That's for business owners. If your business is up and running, then I would highly recommend the NHS bidding program. You can pay over a 3-month period. But, you know, what losses are you experiencing right now by not acting on this? If you've been running for a year, you've missed out on a year of getting contracts, for example. If you've been running for 2 years, you've missed out on, you're looking at possibly $1 million that you've lost in revenue. That's a big loss for your organization, isn't it? So do think about that. If you haven't started, then join the bootcamp. It's for starters. You go through setting up your company, website, content, etc. On day 3, we do contracts, where you apply for contracts, where I am there, and I'm there to answer those tender questions with you. And we've had it where people have submitted the contracts, but you've got to do the work. You know, this is potentially getting you to 7 figures in your business, multiple 7 figures in your business, but you've got to act. If you don't, and you've got to keep focused and disciplined every single day. That's got to be your drive. So do book a free 15-minute consultation with me. It's first come, first serve, just to let you know. We can't have any more than 20 in the group. You'll also get a private group, and that's for the boot camp. As the boot camp group is going to grow to about, I think it's about 1,000 members, for example. With the NHS bidding, there's a private group, closed group there as well. And, you know, we're constantly communicating with each other, and you're there to encourage one another so that you're motivating each other. You'll see when someone's doing well, and then that's going to encourage you to get on and do what you need to do for your business as well. You'll be able to watch things straight away. So do book a call to discuss in depth the program that we're offering to you. This is the 12-week module, what we discuss. It is how to present your organization, week 1. This is so powerful, so powerful. So powerful. The testimony you get tomorrow, you'll get to see what that directors are saying, how wonderful it's been for them. Templates for bidding, packs you'll get, where to find contracts, government, private, NHS, how to submit your tender, finding contracts, purpose of the proposal and the project, your job summary, services or products that you will be providing, procurement standards and operation procedures, your SOPs, pricing, information, work down, breakdown, structure, storytelling, and much more. You want to attract the buyer by you providing the services that they are looking for. I'm so passionate about this because I know it works. But I know it works when you implement and take action. Like me, that's what I did many years ago. Okay. So are you feeling that you want to get to 7 figures in your business, or even 6 figures in your business? Maybe you're an established business owner and you're not knowing where to get further contracts because you've been stuck in one area, maybe home care or recruitment, for example. Do you want to get up to 4,000 hours a week in your business? Maybe you're doing 75 hours or 300 hours a week. You may have a niche, either home care or nursing agency, but you need to do multiple businesses to create a multiple income stream. This is the perfect solution for you. And boy, have I got something massive coming up in the next couple of weeks. It is going to be phenomenal. You'll be absolutely amazed with what we got coming up for you. So please do stay tuned, join, subscribe. You'll get to see up-to-date information. You don't want to miss out on this. This is an opportunity that you don't want to miss. But this is the opportunity as well. So, like I said, join and learn the secret strategies. The strategies that I discussed in the NHS bidding program is amazing. The knowledge that I've learned over 30 years, I'm passing that on to you so that you can learn and build your business without relying on someone else to build your business for you. You want to learn how, you're a director, you want to learn how to do these things. When you've got the money, then yeah, you may want to pay someone, to keep doing contracts for you after contracts. That's fair enough. But at the same time, you still want to know how to do these things. Why leave it up to someone else? Why put your business in someone else's hands when you need to learn how to do these things? At least learn how to do it. I'm not saying that you to do it every month, get someone else to do it, but someone has to be doing this in your business because contracts can end. So you've got to always keep replenishing things all the time, constantly. Same with your staff members. You've got to constantly keep recruiting every single week. You don't just recruit when you need some staff members to cover a shift, because only half of those staff members will really go out and do the work because they're, for whatever reason. So you've got to constantly be recruiting every single week in your business. You must do that. You've got to do that. Otherwise things dry up, for example. So just to say, the aim of the NHS bidding program is for you to apply for a minimum of 3 contracts. The boot camp, the aim of that is for you to apply for at least 1 contract, not just sit and watch me. I'm not a TV show. I'm not, I'm not some program that you're watching, a TV program. I'm there to get you to implement and take action for your business, for your livelihood, for your empire, so that you're able to leave that legacy. And I want to be a part of that journey. Just like I've paid over 200 grand for mentors. I'm still in touch with one of my mentors from 9 years ago, Joel Bauer, absolute brilliant mentor, but I've done things, I've done what he's taught me. And that is what I'm meant to do as a mentee. I'm meant to take action, not just watch and just put things on the shelf and then pick it up whenever I feel like it. You've got to motivate yourself and act on it and remember the why. The reason why you're doing it is for your family, your loved ones, for you. You know, you want a better business quality of life, don't you? And you can achieve that. And you can do this from home. You don't have to go into an office. You can do it from home and be happy and see to your needs, your family's needs, your friends' needs. You know, it's just, we're in such a strong world now, even though you may not think so, that we can actually work from home. You don't have to be rushing off to work, doing 12-hour shifts for someone else building their empire. Build your own. You're capable of doing that. If I can do it, you can do it. You know, I've been homeless with my 6-week-old baby in a mother and baby unit. That's why I created the mother and baby unit, because I knew what it was like when I was trying to find somewhere to live. I didn't realize that I could have claimed social security. I was working 3 jobs while being pregnant. Then I couldn't work anymore and I couldn't pay my rent. So I was evicted. So I had to go into a mother and baby home in a shelter with a 6-week-old baby. But thank God I found my husband, who's now deceased, of 28 years. I had a wonderful, wonderful marriage, wonderful relationship. I lost my husband. I lost my mother on the same day as my husband of 28 years. But because I had the coaching, and because I had the money blocks, the mindset training, I was able to cope. It helped me to push through, even though it's a difficult time for me. And I want the same for you. I'm now remarried. I'm happily married, and I'm wonderful, blessed to have a wonderful man in my life, and my children are happy now as well. But, you know, I just want the same for you, that you can do this. If I can do this with what I've been through, then you certainly can as well. Okay, so do book your free 15-minute consultation with us, and we will gladly speak with you, to talk with you, and to see what program is suitable for you, because we have programs from £17 upwards. So, you know, it all depends on where you are and where you want to be as well. And I'd like to help support you in that journey as well. I'd love to be your mentor, your coach in your journey. So I hope that you found today helpful. And like I said, there's Lillian. She's got a contract with Nottingham County Council. She got multiple contracts as well. And, you know, we've been able to support our clients as well. And I hope that you are able to book your free 15 minutes appointment with us. Yes, I understand. That's fine. That's fine. I look forward to speaking with you soon. Do join our programs, because you will learn so much. You will learn so much. 30 years of learning you're going to get from me in a short space of time. And that is remarkable as well. We're also global. We're a global organization, and we're doing global healthcare now as well. So do join us. Thank you. Do join us for our 15-minute program, and I'd love to, 15-minute appointment, sorry. And I'd love to say thank you for joining us. I want to say thank you. Stay blessed. It's been my pleasure. I hope that I've served you well today, and I look forward to speaking with you all soon. Do book your appointment now with us, because I'd love to get you started. And you're welcome. You're welcome, Spiwi. You're welcome. Thank you so much, all of you, for being here today. Let's get started. We're nearly coming towards the end of 2022. Let's make this happen. Okay, get your business up and running with contracts before the end of the year comes, so that you're bringing in 2023 with a multiple income stream business that you're going to feel happy that you've made that start from. So thank you so much, everyone. Thank you for being here today. Hope you found this very, very helpful. You'll also get the recording as well. Stay blessed, everyone. Thank you so much. Thank you. Thank you. Don't forget to book your free 15-minute consultation with the team. You're welcome. You're welcome. Thank you so much. Thank you. Have a wonderful day. Enjoy the rest of the day, everyone. I look forward to speaking with you soon, and join us as well for our next web class as well for next week. Have a wonderful day. Thank you, everyone. Bye. Take care. Goodbye. Goodbye. Take care. Bye.